afternoon. Thank you for joining us on this Monday for our press briefing. This is a milestone press conference for us. The mayor will give you many more details on this very special press conference. Today, the mayor will discuss Orange County's effort in assisting the state with the vaccination process and give an update on COVID-19 cases, positivity rates, and much more. From the Florida Department of Health in Orange County, Dr. Raul Pino is here, of course, with his important information and updates on the vaccination process, as well as the COVID-19 trending in our area. Unfortunately, Mayor Dyer could not be with us this afternoon. We're going to begin with Mayor Demings in one moment. I just want to remind all the reporters, we're going to ask you to please respect our one-question format. If you have a question, we're happy to answer it. The mayor and Dr. Pino will answer for it. Please just ask one question during the Q&A period, but they both will remain here for as many questions as you want after the press conference, but please, during this portion, just one question, please. All right? We thank you for that respect and consideration, and we begin with Mayor Demings. Mayor?
All right. Good afternoon, all of you. As you can see, Dr. Williamson, he's tough today. But as he said, this is a noteworthy day in our fight against the COVID-19 pandemic here within our community. And guess which milestone we have reached? We have now reached 100 news conferences since we started. And what I'm going to do today is just kind of walk you through the last 10 months with some of the different things that occurred during that period of time. Our goal has been to keep the public fully informed while trying to slow the spread of COVID-19 within our community. And I believe that we have done that, but we've had our ups and our downs. I want to take a few moments to highlight those ups and downs. Today is also represents the 305th day that we have been activated under a state of emergency here within Orange County. Despite being in a pandemic, there were a lot of high points to share, and I couldn't be prouder of our residents and our staff during this period of time. There are going to be some photos that are going to flash behind me as I talk about the different periods of time over the last many months. In April, Orange County was the first to form an economic recovery task force made up of county leaders and small business owners who tackled the daunting task of trying to reopen the county while following safety protocols. We discovered residents and businesses who took it upon themselves to make a difference in the community, and so you can see that on the photo. We honored restaurant owners who created safe and sanitary spaces for their workers and patrons. A group of UCF and Rollins College students called Mask On were highlighted. They created free wellness kits which were given to 3 different Orange County elementary schools. And we showcased a young man who spent over 400 hours at our testing sites putting together over 12,000 packets of PPE for distribution. Then we move on to our Animal Services Division. They did a yeoman's job of initiating 2 pet food giveaways, and this was something that we did for cash-strapped owners over time. We gave away tons of pet food. We also conducted news conferences in Spanish and in Haitian Creole. My assistant, who's joined us, Ms. Ilia Torres, attends every news conference, and we also had translation done by Mr. Ernst Thurville, who provided Haitian Creole translations. Now let me talk a little bit about our Karazhak Funding. We were fortunate as a county to receive a direct allocation of federal Karazhak dollars. In fact, we received $243 million, and that money has gone a long way to assist our communities. Now I'll talk a little bit about what we did with the funds. The monies assisted families to keep them in their homes or pay necessary bills such as paying utility bills and paying for medicine and other items. We also helped small businesses stay open. We gave funding to nonprofits that directly help residents. As well, we provided necessary testing, vaccination support, and PPE to our community. We also used our small business CARES funding, which was about 30% of our overall CARES funding. Over $69 million in local CARES funding went to small and home-based businesses in Orange County. And we are proud to report that 65% of those dollars went towards minority and women-owned businesses. In total, nearly 8,000 Orange County small businesses received small business grants. Grants were able to cover rent, help make employee payroll, cover the purchase of personal protective equipment, and other related expenses. Then we allocated about 40% of the funding towards social services to meet community needs. More than $84 million in local CARES dollars were allotted to social services and community needs. Our CARES for Individuals and Families program helped more than 65,000 individuals and families with $65 million in funding. This money went directly into the hands of our residents who needed it most. The county also assisted local nonprofits, including the Early Learning Coalition, Career Source of Central Florida, Second Harvest Food Bank, the Coalition for the Homeless, and the LGBT+ Center in Orlando. These nonprofits helped get much needed resources into our community during the pandemic. To date, that represents more than $22 million expended to support services for child care, job retention, homelessness, mental health, and food insecurity. We also allocated about 23% of the CARES funding towards public safety needs in our community. $56 million was invested in public safety efforts that provided 7-day-per-week testing at Barnett Park. The monies also helped the Department of Health in Orange County staff the Convention Center vaccination site, which is obviously open today. We support the efforts of Dr. Pino and the Department of Health in Orange County. Those dollars also helped get personal protective equipment into the hands of community organizations, faith-based organizations, small businesses, and our community. To date, we have given more than 25 million face masks away and 2 million containers of hand sanitizers. Now let's put the COVID numbers into perspective during these last few months. We got our very first, we got our very first reported coronavirus case on March the 14th of 2020. March the 14th, we got our very first case. And so I'm going to go over the numbers as we approach today to remind everyone how quickly the disease spread. You can see at our June the 1st news conference, which was about 4 months in, on that day, we announced that there were a little over 2,000 cases. Then look what happened thanks to repercussions of the Memorial Day holiday. Within 30 days, cases increased 5-fold as we jumped to nearly 10,900 cases by July 1st. The mask mandate went into effect on June the 20th, but the genie was out of the bottle at that point. Now, to put that into perspective, it took nearly 4 months to reach over 10,000 cases. At our press conference on January the 8th, we told you that between December the 30th and January the 8th, that 10-day period of time, we saw 10,000 cases in that 10-day period of time. But from March 14th until July the 1st, we had 10,900 cases. Thanks to the Thanksgiving and Christmas holidays, you will note new highs between November and December, then December and January. So here we are. Cases are still increasing, but we now have the vaccine in our arsenal in the fight against COVID. The total number of Orange County residents who have received their vaccinations shots as of this morning was 43,412. I will note that 406 individuals are non-Orange County residents. The total number of those vaccinated represents approximately 3% of our county population. That number includes hospital vaccinations as well. So these are all of the vaccinations within our county. One of our partners, Orange County's True Health, is also offering a limited amount of Moderna COVID-19 vaccine at select locations. So True Health has about 2,100 doses that they too are offering here within the community. Those who are able to receive the vaccine include healthcare personnel with direct patient contact, persons 65 years of age and older, and long-term care facility residents and staff. Those are the ones who are available to get the vaccine through True Health. More information about the vaccination opportunity is on our webpage at ocfl.net/vaccine. I want to talk a little bit about what we're doing with our senior facilities. Beginning today, Orange County Fire Rescue and teams of EMS staff, to include paramedics, have started visiting senior adult communities to provide information flyers about the availability of vaccination. These preliminary visits are to educate residents about the vaccine and when the fire rescue teams will be in their specific community to dispense the shots. We anticipate that we will provide the shots to the community within the next few days. And of course, this is contingent upon the overall supply of the vaccine that we receive here within Orange County. Numerous senior living communities will be visited as part of the Orange County Fire Rescue Department's initiative to help vaccinate the 65+ community. This effort is in cooperation with the Florida Department of Health and will be offered through mobile vehicles with medical support staff to dispense the vaccine. Remarkably, all demographics in Orange County want to be vaccinated. But we are limited based upon supply made available through the state. I ask our public to please be patient as supply increases. We are prepared to ramp up inoculations. Since the pandemic began, there have been a total of 87,688 cases reported in Orange County. A reported 797 Orange County residents have died as a result of the novel coronavirus. That is an increase of 20 deaths since our last briefing this past Friday. As I've been saying all along, one death is too many. We send our hearts and prayers to the family members who have lost additional loved ones to the virus. Now let me talk a little bit about the testing. Our Orange County Health Services site is open at Barnett Park between the hours of 9 a.m. and 5 p.m. 7 days a week through January the 30th. The site offers both PCR or molecular and rapid tests. For information about testing, you can visit our website at ocfl.net/testing. Many people ask questions about our compliance or strike teams and the work that they've been doing, and I want to report out. We told you on Friday that they would be visiting restaurants, nightclubs, and other lounges in our community, and they did so. This past weekend, 4 warnings were handed out. We want to thank the Orange County Sheriff's Office for providing deputies to assist our compliance teams in these efforts. Since the executive order was issued in December regarding the institution of compliance or strike teams, they have visited 895 businesses and have issued a total of 75 5 warnings, and 13 citations. The teams have visited over 6,300 different sites, and the compliance rate is 99%. And now, I'll turn it over to Dr. Pino. That's the update that you have seen, the photographs behind me kind of go over time.
Good afternoon, everyone. Thank you, Mayor. The Mayor gave you the updates on the numbers for the testing sites and the number of cases, as well as the number of deaths. So I'm going to concentrate a little bit on vaccinations today. As you know, you probably have received calls and emails and texts from our residents. We have paused registration on the website for the Orange Convention Center. Why we did that? We did that because we reached over 70,000 appointments, and that's a significant number. That's about 35,000 clients. That's dosage 1 and 2, and those are future appointments, not the 14,000 that we have that. So these are future appointments. So with that, we were starting getting concerned at several levels. First, the longer out that you give an appointment, the higher number of cancellations you are going to have. Because the longer the appointment is out, the harder it is for people to keep it up. At the same time, many other locations are starting to open in our county, so people are going to move into those locations. Those who have later appointments are going to try to get early appointments, which is absolutely fine. So with that, we ask the public to please, if you have an appointment with us and you decide for whatever reason not to go, to cancel the appointment on the website, because that will open the appointment for another person to use. If you just don't show up, then the appointment doesn't cancel until the end of the day, and we don't have the ability for people to get appointments as they become available. So when we see that happening, we will start opening the site so that people can get appointments that are becoming available as people cancel appointments. And the other is that right now we only have 20,000 dosage in our hands. Now that's changing daily. We got a new shipment today of 9,750 for the county operations, and we will continue to get. But it's also what we are trying to avoid is that for whatever reason, if we have any hiccups in the system or the website or the place itself or the vaccine distribution, we will not like to reschedule a large number of appointments with our residents. So we are trying to, navigate things in a way that we keep it under control, but also manage the expectations out there in our community. So that's the only reason why we paused the site, because it was getting a large number of appointments that right now, today, we will not be able to sustain because we don't have 70,000 doses of vaccine. We are going to have it. We have no concerns about the distribution at this point, but we don't have it. So as we acquire vaccines or get more vaccines from the state, we will continue to do that. So the system will probably open on weekly basis, and it will be up and down as we see the needs. Just to give you an idea, our population estimates for our county this year are 1 million people, 475,000 with 479 residents. That's 1.5 million almost. With that, we have vaccinated, as the mayor mentioned to you, in all different efforts, about 43,818 individuals, and 406 were not county residents. Now, this is probably people who are employees of our health systems, most of them who live in other areas of the county. When we say outside the county, it doesn't mean that these are people who do not live in Florida or do not live in surrounding areas. Although we are getting calls, emails, and texts of people who are visiting or wanted to visit, and they are wondering if we can have a second dosage for them if they are here on that visit, which is, the answer is yes. We will try to accommodate that as much as we can. With that, about 3% of our population has been vaccinated, so we are moving rather quickly Last week, when we talked to you earlier in the week, we were not even at 1%. We are today at 3%. And with the openings of Advent Health this week, as they announced it, the mayor mentioned the community health centers have received a limited amount of the vaccine. We are going to open a closed pod site with UCF for the employees who are 65 years and older. And that's going to be about another 1,000 individuals that are going to be vaccinated. And we are also working with the school system to open a closed pod for the employees that are 65 years and older. So as you see, things are moving quickly. The emergency services provider, not just for Orange County unincorporated areas, but also for the municipalities, we are also working, and they are going to be all involved. And as soon as we can train and have the protocols in place, we will expand it. And what you are going to see basically is you are going to have these large community open sites, convention center, UCF, and in the future others that we are planning, that are going to be able to bring hundreds and hundreds of people. And then you are going to have smaller operations that are going to be dedicated to those situations where those are individuals that are hard to reach, or they have difficulties coming to us, either because they are physically impaired, or the socioeconomic status, or because they have limitation with transportation. Again, we are going to get to all of you. We just cannot get to all of you at once. That's the only limitation that we are having. Just as a note, about 58% of all vaccinated individuals are female. So this is a challenge for the guy. We have to keep it 50-50. So we would like more guys to come through the vaccination site. And another observation, at least in the Orange County Convention Center side, is that we want to increase the presence of our minorities, of the people of color. Please make the reservations when they become available. It is important for people of minority descent to get vaccinated, because these populations are most affected by the pandemic itself and may have a higher rate for death than others. With that, I will open to any questions that you may have. Thank you. Mayor.
Thank you, Dr. Pino. And for any of our Spanish-speaking media that's present, I want to just note that we do have two of our commissioners, Spanish-speaking here, Commissioner Uribe and Commissioner Gomez-Cordero, and then we have my special assistant, Ms. Ilia Torres, who could assist with translation in Spanish if needed, and then Dr. Pino is fully bilingual. All right, with that, we'll open it up to any questions that you may have.
Lauren Seabrook, Channel 9. My question's for Dr. Pino. When we're talking about the 79% herd immunity that is our goal, it sounded like you mentioned out of that 3% that have been vaccinated, that does include some of the people who may be from outside of our community, but not a lot. I'm also curious if your staff looks at how that compares to the number of people in our community who have had COVID-19 and may also have some immunity that would add to our herd immunity.
Very, very good question. And I didn't think about that one, so I have to pass the answer. But for the first one, the percentage that we're calculating is just residents. It doesn't include those who are not residents of our county. So those 406 are not included in the 3%. With regard to the second one, that's a very good question. The issue with immunity acquired from the disease itself is the natural immunity, and that's how it's called. That one is called natural immunity. The natural immunity acquired, we don't know how long it's going to last. So we are asking individuals who have had the virus not to come in the first 90 days after the diagnosis, because the immune system is producing enough to, defend in case of a potential reinfection, if that's the case. But that will be interesting to calculate. So I'm going to ask our EPIs to calculate based on the number of people, if it was all natural immunity, and if we were to last to this point, what percentage of the county has immunity? That's a very good question that I will explore.
Mm-hmm. Amanda Dukes from WESH. Dr. Pino, this is for you. When it In regards to the portal closing to make appointments, or at least pausing, you sort of gave two reasons. You talked about the issue of the further out you book, the more likely you're going to have a lot of cancellations. But then you also did say at the end, you have more appointments right now than you actually have in hand doses of vaccine. So which is it, or is it both?
It's a both. It's a both. Our major concern is about cancellations. For example, not yesterday, but the day before yesterday, we have 169 cancellations. But we don't know those until the end of the day. Because by default, the system, if you don't cancel, it will cancel at the end of the day. So those were 169 people that we could have offered that vaccination. And also, people should know, part of keeping things dynamic is that we pre-draw the vaccines. In order to speed up the vaccination process, we pre-draw the dosage. So we have to be careful how much we put out of the vials because we don't want to waste vaccine. Because after you withdraw, in some cases, they can only be used for 5 hours after you put in the syringe. So there are all the elements that are a little bit complicated for this kind of format, but they are. What is important to us is we need to know approximately the exact number of people that are coming through the pipe every day so that we can prepare for them. So it has several layers while we make those decisions.
Emily Braun, News 13. A lot of my question was just answered, but just to kind of get a better idea of, about how many people or vaccines a day this is affecting with people just not showing up to their appointments, if you have that figure.
Well, a day, I can tell you, yesterday was very close to the regular number. So also what had happened, and to be fully honest with people, is also that some couple have come together. And someone had an appointment later in the afternoon, and they came both in the morning. So there are multiple situations. But not yesterday, I don't know the number for yesterday, but the day before yesterday, the cancellation was 169. So those are numbers that we have to be careful when we are pre-drawing the vaccine. And by the way, we have zero waste this far. And waste means you draw more than you need. So we have not wasted one single dosage.
Samantha from Fox 35. Dr. Pino, you kind of also answered my question. I was going to ask about vaccinations being wasted. In that case, what would you guys do if you have extra doses? We're seeing situations in other counties where just random people who may be working at the site will get it because they've already opened it. Can you go a little more into what exactly will happen if you guys have an excess of vaccinations? And do you consider this cancellation, these cancellation numbers a big problem?
So the cancellation numbers are not a big problem as long as we know that they have been canceled. They become an issue when we don't know. And that's why encouraging people to cancel the appointment, not just not to show up, not to not show up, because the system will not let us know. So they ask is if you are not going to come because you got the vaccine or you found another route, it's better if you please cancel so that we can give the appointment to someone else. With regard to, well, we have almost no waste. Zero waste, but at the end, sometimes we have 5 or 6. So the first choice is for the employees. Our employees have the first choice of taking those vaccines. They are, anyway, having the right to get the vaccine as part of the program. So many of them decided to do it at the end of their shift. So that's happening. And we have given maybe 3 or 4 to Orange County employees, that is convention center employees that were 65 years and older that were around us at the time that we have those few dosage left. It's important for them also, those who are working with us in the convention center who are employees, even if they are not 65, to be vaccinated. Because part of what we want is to create a protective environment there where our employees are not getting the virus. The least that we want to happen is to have an outbreak at the site that we are performing the vaccination. That would be a disaster.
Nikki Zizazo with News 6. My question is for Mayor Demings. Mayor Demings, following the violence at the Capitol, the FBI issued just a few hours ago basically a bulletin saying they're expecting more protests throughout the country. We would like to know here in Orange County, is there going to be beefed up security? And, in light of this news that we are getting that more protests will be happening at capitals all over the country?
I was advised earlier today by the Sheriff's Office that they are working very closely to monitor any developments through the intelligence community across the country on whether or not there will be any planned demonstrations, et cetera. At this point, I've been advised that there are no planned demonstrations here in Orange County. Of course, that can change hour by hour, but most of the demonstrations at this point are planned for state capitol buildings and Washington, D.C. But as a former law enforcement officer, I can tell you that what the Sheriff's Office and all of our federal, state, and local law enforcement agencies will do, they will plan for the worst and hope for the best. So their contingency plans will assume that there could be potential demonstrations here, and whether or not they deploy those resources will be based upon what is actually happening in our community at the time.
This is for you too, Mr. Mayor. Steve Hudak from the Orlando Sentinel. We're about to have a change in the White House, finally. And what, if any, policy changes do you see happening with either a CARES Act assistance or vaccination delivery?
That's a difficult question to answer because I believe that with the incoming administration, there are going to be some adjustments. Of course, the president-elect has said that within his first 100 days, he intends to ensure that 100 million persons are inoculated during that period of time. That means that's about 1 million people a day. Presently, what is occurring on a daily basis throughout the country comes nowhere close to that number. So that means that if they continue with the strategy of distributing the vaccine to the states, they will have to significantly increase the amount of doses that they are distributing within the various states, and then the state will have to redistribute that into the counties and local communities throughout. I believe that we are prepared if we see a significant increase in the available supply of the vaccine in this community. We have contingency plans to be able to ramp up very quickly. And so that's what I would tell you. In terms of the testing, I believe that you can likely continue to see significant testing that will be made available, but it's unclear in terms of what the incoming administration's total strategy will be to contain the virus. But suffice it to say, it's going to include, I think, making certain that communities have available protective equipment for those frontline workers, for members of the American population to be able to wear facial coverings and the like. We may see an adjustment in terms of a national mandate, if you will, regarding the wearing of facial coverings. And I believe that as additional vaccine becomes available, you will likely see the supply ramp up very quickly, and the goal is to make it available to the general public, to include persons who are not 65 years or older, who are not healthcare workers or first responders, to the general population. And so with this 100-day rule, if you will, the president will be sworn in on January the 20th. And so if you look at that 100 days subsequent thereafter, that will put us 3.5 months into the calendar year. So that puts it into an April period of time. And it would be wonderful, I believe, if we could get up to the 79% that Dr. Pino is talking about. But in order to be successful in reaching that number, we would have to significantly increase the number of people who are being inoculated on a daily or weekly basis. So that's the desire of the incoming administration. And we're going to support those efforts here locally, and that's why we have one of the best staffs, logistically speaking, to be able to work in collaboration with the state, with the private sector, and our plans contemplate all of that. We want to be able to tap into the healthcare workers who are certified to be able to provide the shots, and we are identifying all of those persons. We have been proactive in making some requests to the state of Florida for additional nurses and others who can administer the shots, and we're surveying our private sector clinics, physicians' offices, et cetera, who have indicated they have staff that's ready and capable to assist in the process.
Okay, good afternoon, Dr. Pino. This question is coming to you from Gail Pascal Brown with WESH. Her question is, Johnson & Johnson is coming out with a new vaccine. They're seeking emergency FDA approval in February. It is a one-dose COVID vaccine. Have you received any information regarding this vaccine, and what could this mean for the county, obviously, especially not needing a second booster?
I have not received any detailed information on the vaccine. I know what is on the news. A one-dosage vaccine, depending on what the condition for refrigeration and other elements that are to be considered, could be a game changer in adding speed to the process, as individual may not need a second dosage. But I was explaining to one of the reporters today that giving the vaccine is the easiest part of the entire operation, because that's a 2-second thing. It's like ping pong gun. The concern is always what goes even before or after you've received the vaccine. That's what complicates the operations, especially data collection. That's why this system that we have in place with CDR McGuire through the county has provided us with the speed, because all the information is collected prior to the individuals getting to us. And that's why it's so important to have this QR code, because all the information is contained here. And if you don't have this QR code, they will turn you away from the site because we don't have the information on you.
The next question is also for you, Dr. Pino, coming from Greg Angel with News 13. Park employees and out-of-state visitors tell us they've tested positive after visits at the local parks. What data can the state provide that supports what the state is saying, that parks are not sources of COVID spreads?
So it's interesting. Other reporter also asked me that question earlier. So let me clarify a little bit that data. If the question is, have you had any cases in the parks? The answer is yes. Of course, we had cases in the park. Now, we haven't been able to identify outbreaks among visitors. The outbreaks that we had in the park, and I don't have any information that we are running through any active of those large outbreaks, is among employees. Now, remember that also the parks have multiple employers. It's not just Disney or Universal or SeaWorld. Within the parks, there are other employers. Now, what we haven't been able to detect is individuals who came visiting to the park, left the park, and got infected, or we can assume that got infected at the park. Has that had happened? Probably. Do we have proof of it? No.
The next question is for Mayor Demings, also coming from Gregory with News 13. The county's COVID strike force said it would visit area theme parks again. Did they, and what are the findings of their inspections?
They have visited the theme parks several times over the last few months, and they have always found them to be compliant.
The next question is for you, Dr. Pino, coming from Nadine Jans with WKMG. Her question is, do vaccines expire? Have any vaccines had to be thrown out in Orange County?
So, in Orange County, I don't know. At the convention center site, no vaccine has been thrown. With regard to expiration, they came in a single lot. They are going to be used very fast, so the expiration is not a concern.
The next question is for Mayor Demings, coming from Melissa Thomas with FNN News. Her question is, you mentioned that all demographics are requesting the vaccine. Do you think the leaders who volunteered to take the shot during the last Wednesday's press conference helped increase some groups' willingness to take the vaccine?
I do believe that because we had a cross-section of seniors who took the shot on camera last week, they are influences in our community, and I believe that in certain demographics, that matters to people. If they see average citizens, they see their leadership not afraid to take the vaccine, I think it matters to some people. There are always going to be some who are going to be skeptical, quite frankly. There are individuals within the healthcare community who are skeptical. But at the end of the day, that all of the experts and the literature that I've read, the conversations I've had with Dr. Pino, other physicians, our physicians that are on staff here with Orange County, they have all assured me that it's safe to take the vaccine. I took the shot. I did not have any reactions, negative reactions to the shot. So that's what I would tell you. We do encourage everyone to. Now, as I said earlier, all demographics, they email us, they call our office, they see me out in the community, and they approach me and they say, when am I going to be able to get the vaccination? And sometimes they're teenagers, sometimes they're young adults with small children. Sometimes it's our own county employees who do not fit into the categories in question. So I truly believe that the majority do. So let's test it. Okay, out of those of you, the media that's in the audience today, if we gave you the opportunity to be vaccinated today, how many of you, by show of hand, will take the vaccine? Would you raise your hand? Okay. So I think you represent the community. So those who couldn't see it from home, they all raised their hands. So they're like everybody else. That's why I say all demographics in our community at this point are saying that if made available, they would take it. So that's a good thing. That's not the case in every community, but I can say that that appears to be the case in this community.
Mayor, what do you think will happen if we say we have the vaccine, come on?
I don't know who would run to be first. If Dr. Pino's question was, if he said, we got it now, step right up, how many of you would come forward to roll up your sleeves? But it really was a painless process. So, you know, I'm not one that likes, if you're like me, I don't like taking shots because some of them I've had in the past have been pretty painful. But that one was not. I have to say, in my lifetime, in my 60-plus years, in my lifetime, that was the least painful shot that I've ever taken. I just hope all the rest of them are like that.
All right, the last question comes from Ryan Lynch with the Orlando Business Journal for Dr. Pino. How might the increase in travel potentially impact the level of herd immunity? Does the 79% take into account the impact of tourists returning at some point?
No, it doesn't take into account that. That would be very difficult to account for. But, you know, the entire nation has a program for vaccinating. So at some point in the near future, everyone who's coming, or the majority of the people who will be coming, will be also vaccinated.
One last question for you, Dr. Pino. It comes from Steve Mort with WUCF. Given the state's priorities, do you have a sense of when essential workers like teachers may be able to get vaccinated in Orange County?
Well, as I mentioned before, we are hoping to be able to work with the school system. We are engaged in some planning to be able to vaccinate all the employees at the school system that are over 65 years old. So the question for those who are over 65 years old, that are employees of the school system, they probably will get the vaccine in the next couple of weeks. For those who are not in those group, they will have to wait for those priorities. But I assume that it would be safe to think that if we have done this for the 65 years old, we can also do it for all the populations, different close paths across the county.
All right, you all did very well today. Thank you all for joining us, and we will provide another update to you Friday. All right, have a great week.